Hey there, today let's talk periods. It's a natural part of being a woman, but it can feel mysterious. Simply put, your menstrual period is that time of the month when you bleed from your vagina. This bleeding happens because the lining of your uterus is shedding. Why? Because an egg wasn't fertilized. It's your body's way of hitting the reset button. Now, the menstrual cycle is the whole shebang, from the first day of your period to the day before your next period starts. Think of it like a clock, constantly ticking away. It's controlled by hormones, those chemical messengers that tell your body what to do. During your cycle, your ovaries prepare an egg to be released. This is called ovulation. If that egg meets a sperm and gets fertilized, you could get pregnant. But if the egg doesn't meet its match, it breaks down, hormone levels drop, and your period starts. Then the whole cycle begins again. Fascinating, right? Knowing the length of your menstrual cycle is like having the key to a secret garden. It can unlock a deeper understanding of your body and its rhythms. But how do you calculate it? It's easier than you think. Grab a calendar or a period tracking app. Mark the first day of your period, which is day 1 of your cycle. Keep tracking until the first day of your next period. The number of days between these two dates is the length of your cycle. For example, if your period starts on the 5th of January and then again on the 29th of January, your cycle length is 24 days. See, not so complicated after all. While we're all familiar with the textbook 28-day cycle, the truth is menstrual cycles can vary. It's perfectly normal for your cycle to be anywhere from 21 to 35 days long. Think of it like snowflakes. No two are exactly alike. Your cycle length can be influenced by factors like stress, diet, exercise, and even genetics. Knowing your unique cycle length is crucial because it helps you understand what's normal for you. It's like having a personalized health roadmap. If your cycle is consistently shorter than 21 days or longer than 35 days, or if it suddenly changes dramatically, it's a good idea to chat with your doctor. It could be a sign that something else is going on. Detecting ovulation signs and symptoms. Ovulation is like the grand finale of your cycle, the moment when your ovary releases an egg ready to be fertilized. While you might not see fireworks, your body gives you some subtle and sometimes not so subtle hints that it's happening. One of the most reliable signs is a change in your cervical mucus. Leading up to ovulation, you might notice it becoming clear, slippery, and stretchy like raw egg whites. This fertile mucus helps sperm travel to meet the egg. You might also experience a slight increase in basal body temperature, breast tenderness, bloating, or light spotting. Some women even feel a twinge of pain on one side of their lower abdomen, known as Mittelschmerz, which is German for middle pain. Pay attention to your body's whispers. Menstrual myths debunked, separating fact from fiction. The menstrual cycle seems to attract myths like a magnet. Let's clear up some common misconceptions. Myth: you can't get pregnant during your period. Fact: while it's less likely, it's not impossible. Sperm can survive inside the female body for up to 5 days. If you have a shorter cycle and ovulate soon after your period, it's possible to get pregnant from unprotected sex during your period. Myth: all women ovulate on day 14 of the cycle. Fact: we've already established that cycle lengths vary, and so does ovulation day. It typically occurs about 14 days your next period, not necessarily on day 14. Myth: you can't get pregnant the first time you have sex. Fact: this is one of the most dangerous myths out there. As long as you're ovulating and having unprotected sex, pregnancy is possible, even the very first time. Charting your path, tools for cycle tracking. Tracking your cycle is like keeping a diary for your reproductive health. It can help you understand your body better, predict your period, and even identify potential problems. Luckily, there are more tools than ever to help you chart your cycle like a pro. Traditional calendar methods are still effective, but technology has upped the ante with period tracking apps. These apps allow you to log your periods, track your symptoms, and even predict your fertile window. But technology isn't the only option. You can also tune into your body's natural cues by tracking your basal body temperature, cervical mucus, and other physical signs. Some women even use a combination of methods for a comprehensive approach. The power of knowledge, your cycle, and your health. Understanding your menstrual cycle isn't just about knowing when to expect your period or planning a pregnancy. It's about tapping into your body's innate wisdom and taking control of your health. By tracking your cycle, you can gain valuable insights into your overall well-being. Changes in your cycle can be early warning signs of underlying health conditions such as polycystic ovary syndrome, PCOS, thyroid disorders, or even stress. Knowing your cycle also empowers you to make informed decisions about your reproductive health, from choosing the right contraception to understanding your fertility. It's about owning your body, your cycle, and your health. Thank you for watching. Let's continue the discussion in the comment section, and please spread the word by sharing this video. A lot of people still do not understand the mystery of periods, so help them by sharing this video. Ciao!